fireworks injuries. In today's Focus on Your Health, Teresa Snow explains why some might want to rethink those holiday plans.
Focus on Your Health is sponsored by MU Healthcare.
Doctors at MU Healthcare say fireworks are far more dangerous than most people realize. In fact, some of the hottest fireworks available are often handed right to little kids.
Sparklers, which seem very innocuous, they can get up to anywhere between 1,200 and 1,800 degrees Fahrenheit. That is hotter than just about anything else that we encounter in the burn world. At that temperature, it can cause wounds that would require skin grafts and surgery in a millisecond, in a fraction of a second. The next step should be to cool down the burn. Probably don't want ice cold, but cool water to just prevent any thermal damage to those tissues that are retaining some of that heat. And protection with clean gauze if you have it. The sooner that we adequately treat a burn and get it to heal, whether it's with surgery or without surgery, the less likely it is to scar.
Joining me now is Dr. Jeffrey Litt. He's the medical director at the Burn and Wound Program at MU Healthcare. Tell me, do you see a lot of patients this time of year with these types of injuries?
Well, we know that fireworks injuries are fairly common. They're somewhere around 10 or 11,000 over the United States, mostly around the July 4th holiday. We don't know exactly how many of those are related to sparklers, but we do know that a number of them are. In my personal experience, maybe 40 or 50% have been.
What are the stories you hear about children using fireworks?
Well, children use them like they're using toys, and so they don't have the respect for something that can get as hot as 1,800 or 2,000 degrees. And nobody should be playing with something that is that potentially dangerous, but kids just think of it as a fun, bright toy. So they use it as either a sword fighting or they throw it at each other because it seems kind of cool that it explodes when it hits the ground. And, you know, they're children. They don't know what they're doing.
If you have a home firework display, do you really need someone to manage the scene?
Oh, I think so, absolutely. I think just like we have designated drivers when we go out to have a good time, we should have a designated lighter. Someone who is not drinking, who is keeping an eye on things, especially if children are around, making sure that they're away from where the fireworks are being lit, making sure that if sparklers are being used, that they're not running around haphazardly pointing them at each other.
Good advice. What other types of burn injuries do you see this time of year?
We end up seeing a lot of accelerant-related injuries from people throwing gasoline or other accelerants on bonfires. Some people do it to burn off their brush pile. Some people do it on a bonfire just because they're having a bonfire-type party. But they're always surprised when they come in after their burn injuries happen at how quickly these things can flash up on them and how serious these burns can be.
Thank you very much, Dr. Jeffrey Litt with MU Healthcare. I'm Teresa Snow, and that's Focus on Your Health.
Focus on Your Health has been sponsored by MU Health.